How long have you been qualified to do what you do?
So I graduated from Sydney University as a vet in 2005. I spent 3 years in cat-only practice up in Brisbane, and then I moved back to Sydney and I did my internship at the Animal Referral Hospital when we used to be over in South Strathfield.
Oh, okay.
So I worked there for a year, did my internship. Once I finished, I spent a little bit of time working as an emergency doctor, and then I started a medicine residency at the University of Sydney. And about halfway through my medicine residency, I realised I chose the wrong specialty, and that I really, my love was emergency and critical care. So I finished my residency, but I never sat boards for internal medicine, and I pursued a critical care residency at the University of Wisconsin. So I started that in 2012, finished in July 2015, sat my boards in September of 2015, and I've been qualified since then.
Okay. What value is a position like yours to the average pet owner, or to veterinarians even?
Yeah. I think it's a really good question, because I think critical care is still kind of in its infancy. The college has been in existence for about 20 years in the US, but it's really only in the last sort of 5 to 10 years in Australia that criticalists have started to become more common. And as Maren said before, there's about 25 of us now in Australia total. So I think what we provide is we really provide that really acute care setting. So we're kind of on the front line of if you need ventilation, if you have a dog that's really sick with pneumonia, if you have a case that has sepsis, that's where we really excel. We kind of excel in those, managing those cases that often require extensive care over a period of days. And so we kind of, because our specialty crosses other disciplines, so we have to know a little bit of medicine, we have to know a little bit of surgery, but where we really, the two areas that we really excel at are that kind of emergent case that might be a toxin or a tick paralysis or a snake bite, but we also really excel at anything that needs kind of that advanced monitoring and care.
Okay. Now, it's one thing to have you as a 24-hour emergency and critical care specialist, but you have to get some sleep sometime.
Yes.
So what happens when you're not here?
So when we're not here, we have a wonderful team of emergency vets that manage cases, and they're very experienced. We've got vets here that have been doing emergency medicine for over 15 years, and so we're lucky that we do have that really strong team that can continue to work on cases. Both Maren Hicks and myself will be available for advice as well on those cases where there is an extra thought potentially needed, or just putting our heads together to figure something out, because I think one of the things that I didn't really understand, at least when I first graduated, I thought, one day I'm going to have all the answers. That day hasn't yet come, surprisingly enough. And so, I think that's one of the luxuries about working in a place like this, where there are so many other specialists and there are, lots of emergency vets as well, is that there's always someone that you can run a case past or talk to. And so that goes for our emergency vets as well. They have access to internal medicine specialists or surgeons or criticalists if they have a case that they need some additional help on.